I always put everybody ahead of me, and then this is why I'm in this situation.
I was trying to struggle through life with having a sick daughter, 2 other kids at home, and managing a life that was unmanageable to me.
I was homeless. I couldn't afford anything on my own.
And everything fell apart.
When I first had told my therapist that I was in crisis, and she said that I might need to go to the hospital, I knew nothing about what a mental hospital was like. I thought they were gonna come and wrap me up in a straitjacket and put me in a padded room, and I was petrified.
That's when I really started having more of a meltdown, because everything I thought was going to be okay turned out not the way I had planned. There's a lot of people out there that are like that. You know, they're always thinking about other people but themselves, when they really should start thinking about themselves. But I just never had the time to do it. I was just always going and going, you know.
So I think there's some fear. I think there's fear of judgment. I've had so many people over the years tell me, man, this is gonna sound really stupid, or please don't think anything of me. And my response is either I've felt it, I've seen it, or I've said it, you know.
You know, everyone at some point in their life is gonna need help with something. So making sure that people have access to those services that really can meet their needs to help them the best way possible. And you know, everyone has a story to tell, and sometimes it's really challenging to be able to reach out for help. So having a role to where I can make sure that we are providing a service that really meets consumers where they're at, being that safe place for people to come back to, I would feel is the most rewarding, knowing that we've created that in the community. On a typical day, I would say we see between 25 to 35 individuals, whether they're walking in for services for the first time, they're already scheduled with an intake or medication appointment, or we're going out into the community and actually outreaching them at the residence or the location that they find is the most comfortable for them.
A program like CREST is important because sometimes we feel, especially having a mental illness, that the only avenue is going to the hospital. And sometimes that's not the best option. A hospital's for stabilization, but I might not be at that level of crisis. Somebody might not be at that level of crisis. So it's very important is that because it gives us another option beyond hospitalization. It allows people to be able to work with somebody, but to get themselves well in maybe a home setting, in just doing everyday life and building those coping skills and having somebody that they can talk to on a regular basis, and then get the longer term services that they really need to keep that stabilization in their recovery.
When someone goes into the emergency room, if they don't have insurance or they have limited health coverage, one, it can be extremely expensive for them, and it might not be the level of care that they need. An emergency room is very based off of safety. By coming to CREST, it's a rapid service of an assessment. We have a living room model based for our waiting area, so it's, you know, there's coffee while you're waiting. It's more of a friendlier atmosphere, and you can get services just as fast, if not faster.
Somebody had mentioned to me about CREST, that you can go there and they help you out. They have groups and they help you out with any kind of situation that you had, because I was looking for an avenue to help me out with my illness.
We are a walk-in service, so 7 days a week we're open. Individuals over the age of 18, they can walk in for a brief assessment to see if our program can meet their needs. And what we do is then link them up with longer term services. If they need assistance with medication, we have a prescriber on staff. If they need that intensive support in the community, we go out and see them into their homes or anywhere in the community they're comfortable being seen, and then we make sure they have the resources that meet their needs and link them to that long-term treatment.
my main thing with my illness was I was afraid to go to the mailbox. I was afraid of something happening because I'm so used to something happening, and I thought maybe if I ignored it, it would go away, but it didn't. It made things worse.
So oftentimes still, mental health has such a stigma attached to it. Like, I don't want to reach out for help because people are going to judge me, or, you know, there's something wrong with me, but really, we're all just people. Everyone's one scenario away from potentially having a mental health crisis. Just building those resources and the tools to be able to manage.
I mean, I was a person that kept things to myself. Everything, like I said, I can make people think everything is fine, but when it wasn't fine. And then when I started opening up, and then actually I learned from other people. You know, I never would think I would get into a group and start talking about my problems. Like, I was never that type of person to do something like that. I always kept things to myself. But now I can be a lot more open to how I feel.
So what I think the community should know about CREST is that we're here. Like I said before, we've been here since 2011, and there's oftentimes people come in for the first time saying, I never knew you were here. I wish I knew you were here. I would have told so-and-so, or I would have reached out sooner. Because
I think, especially when you can say that and somebody then supports you, that's all the freedom in the world, you know. If I choose to disclose, that's because I feel comfortable with you, you know, and that's because I'm not ashamed of what my illness is. So yeah, I think the wall definitely comes down when somebody can actually share, and regardless of what the response is, feel like, you know what, I did the right thing. I did the right thing for me. This is going to give me peace about going further in my recovery. So yeah, I think there's a lot of peace that comes with just coming and accepting that this is something that you have, not something that you are.